Can I come in?
Yeah.
Hi. So, before I entered the room, I washed my hands, and as I'm entering the room, I'm going to use hand sanitizer before I examine the patient. I won't be needing any extra protective equipment today until I inspect her oral mucosa, which I will be using gloves. Hi there, my name's Maddie. I'm going to be your student nurse today.
Hi.
Can I see your wristband?
Yeah.
Okay, what's your first and last name?
Brittany Osby,
Date of birth?
10/24.
Perfect. Miss Osby, do you like to be called Brittany or Miss Osby?
Brittany's fine.
Okay, so what's your reason for coming in today?
Just my annual respiratory checkup and a normal checkup.
Okay, cool. So can you tell me, do you have any allergies to food, drugs, or latex reactions?
Nope.
Okay, I'm going to ask you a bunch of questions really quick.
Okay.
Tell me, do you have any history of headaches, dizziness, hallucinations, any ringing in the ears, ear drainage, bloody noses, loose teeth, bloody gums, any trouble swallowing food?
No.
Any shortness of breath, trouble breathing, cough? Have you had any past surgeries that I should know about?
No.
How about some inflammation in your sinuses?
No.
And how about history of glaucoma, any neck pain, dentures?
No.
COPD?
Nope.
And how about asthma?
I do have asthma.
Oh, okay. How long have you had asthma?
I've had asthma for pretty much my whole life.
Okay. Do you know what age you were diagnosed?
7.
Okay. When was your most recent asthma attack?
In December.
Okay. What did you do to relieve the attack?
I didn't have my inhaler on me, but I just kind of let it play its course, and I was fine.
Okay. But you do have an inhaler?
I do.
Okay. Do you know what medication is in it?
It starts with an F, but I can't remember.
Okay. I can look in your chart and we'll figure that out for you. When was the last time you did use your inhaler, though?
About 6 months ago.
Okay. So do you think that cold weather makes it worse?
Yeah.
Okay, it kind of exacerbates that cough.
Yep.
Okay, alrighty. Smoking?
No.
Okay, perfect. That's what we like to hear. Okay, so we're gonna move on to your head and your face now. So I'm gonna inspect your eyes and your eyebrows and all that fun stuff. Okay. So her eyes are symmetrical and midline proportionate to her face. Eyelashes and eyebrows are evenly distributed and symmetrical. Her nasolabial folds are symmetrical. Good. Her palpebral fissures are horizontal. The sides of the mouth are horizontal or symmetrical to her face, proportionate to her face. All right. Now what I'm going to do is I'm going to palpate your TMJ. Okay. It's a joint right here in front of your ear. So I'm going to place my fingers right here. I'm going to have you open and close your mouth. Okay.
Yep.
All right. TMJ is symmetrical and intact. And now what I'm going to do is palpate and percuss your maxillary sinuses. Okay.
Yes.
So you're going to feel my fingers.
Yep.
Tell me if there's any pain or tenderness. Okay.
Nothing.
No. Good. All right. We're going to percuss now.
Yep. Nothing.
Good. Okay. So now what I'm going to do is I'm going to assess for your cranial nerve number 5. That's your trigeminal nerve. I'm going to place my hand under your chin and you're going to open, okay? Good. It's intact. Now we're going to assess for cranial nerve 7, your facial. I'm going to have you raise your eyebrows, puff out your cheeks, frown, smile, wrinkle your nose, and can you whistle? Good.
That was loud.
All right, now we're going to move on to your eyes, okay? So, once again, her irises are round, they're symmetrical. Her pupils are both round, equal, and symmetrical. All right, I'm going to inspect your sclera. I'm going to pull down your eyes, okay? Sclera is pink, conjunctiva is pink and moist. Her cornea is transparent. Brows and lashes are evenly distributed. All right, so now what I'm going to do is called the blink response, okay?
Yep.
All right, ready?
Yep.
Good. And now we're going to test for your light response, okay?
Yep.
Okay. Consensual light is intact. Her eyes are, her pupils are round. Pupils are equal, round, reactive to light and accommodation. And now we're going to test for cranial nerve number 2. I'm going to hold this a little bit away from your face. Can you read that line for me?
Your trusted companion for the assessment lab and clinical settings.
Okay, good. Now we're going to assess for cranial nerve 3, 4, and 6. Okay, I'm going to have you follow my fingers.
Yep.
Okay. Cranial nerve 3, 4, and 6 are intact. Now I'm gonna palpate your lacrimal apparatus. It's just below your eyes, okay? Tell me if there's any pain, tenderness. Good. So now we're gonna move on to your nose, okay? So I'm gonna inspect your nose now. So her skin is pink, it's moist, appropriate for the weather. Her contour is symmetrical. I don't see any lesions or discharge. No signs of a deviated septum, so that's good. All right, so I'm gonna test for patency of your nares. So I'm gonna have you plug one nostril and sniff. Switch. Good. Did you notice a difference?
They're all clear.
Okay, it sounded equal to me. And now we're gonna move on to your ears. So her ears are equal and they're midline and symmetrical with the face. They're pink, they look warm. I'm gonna test for your cranial nerve number 1, your olfactory. All right, go ahead and close your eyes, okay? Can you sniff this for me?
I think that's chapstick.
Yep, good. So cranial nerve number 1 is intact. So I don't see any lesions on her ears. I'm gonna inspect your ear really quick, okay?
Okay.
No cerumen. Switch. No lesions or discharge or cerumen. Excuse me.
It's okay.
Okay. Oh, I also am going to palpate your nose. I'm going to palpate your ears, okay?
Okay.
All right. Got my fingers? Yep. Any pain or tenderness? Nope. Now your ears? Any pain or tenderness? Nope. Okay. And now I'm going to have you plug one ear. Okay. Okay. Can you hear this?
Yep.
Okay. Switch. Yep. Okay. To inspecting your mouth and your neck now, okay? Yep. So because I'm moving on to the mouth, I'm going to now put my gloves on to have proper protective equipment. I washed my hands again before I put my gloves on. Okay. All right, dear, so I'm going to have you open your mouth for me. All right, go ahead and open your mouth up for me. Okay. All right, all teeth are present. I don't see any signs of caries or fillings. Her gums they're pink and they're moist. Okay. Pink moist, okay. Lift your tongue up to your mouth, to the roof of your mouth. Good. Pink moist under there. So her buccal mucosa is pink and moist. All right, I'm going to test now your gag reflex. So for testing her gag reflex, I would place this on her tongue, but because Brittany has a high gag reflex, I won't be doing it to her. Thanks. And so I'm going to inspect her uvula now. Open wide. So uvula is intact in midline. Tonsils are +1. Her posterior pharynx is pink and moist. Her palate is also pink and moist. And now I'm going to assess for your cranial nerves 7, 9, 10, and 12. Can you wiggle your tongue around side to side, up and down? Good. Okay. And now we're going to move on to the neck. I'm going to now take off my gloves. Okay. So what I'm going to do is I'm going to feel for your trachea, okay? Go ahead and lift your head up for me. Okay. Trachea, no deviation. It's symmetrical. It's midline with the head. I don't see any deformities. And now what I'm going to do is I'm going to feel for your lymph nodes, okay? So preauricular, postauricular, occipital, jugular gastric, submental, submandibular, superficial, deep cervical, posterior cervical, and supraclavicular. Number 11, okay? Okay. All right, go ahead and push up for me. Good. So cranial nerve number 11 is intact. So now we're going to be moving on to the respiratory system. So I'm going to be examining my patient's anterior side first. She's currently sitting up in bed and she looks comfortable. All right. So what we're going to do is I'm going to lower your gown down. I'm going to palpate and percuss, okay? Okay. When I do this, do you want me to move your chest or would you like to?
You can move it inside.
Okay. So I'm going to start first by percussing, okay? Okay. So now I'm going to place my hands on your chest and I'm going to have you say 99 every time. Go ahead.
99, 99, 99, 99, 99.
Okay, good. Now I'm going to listen to your lung sounds, okay, dear?
Yeah.
Just normal breathing, okay? Okay. I'm like, oh, what is that? Oh, sorry. Okay, I'll text you. Okay, good. So now I'm gonna help you. We're gonna lift your gown back up.
Yep.
And I'm gonna have you swing your legs over to the side of the bed. Okay, good. So I'm gonna do your back side, okay?
Okay.
Oh, low battery, sorry about that. All right, we will fix the bed later. Okay, so now I'm gonna do the same thing. I'm gonna palpate and percuss, okay?
Okay.
All right. Okay, any pain or tenderness?
Nope.
Okay. So now we're gonna do the 99 again, okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. All right, and now I'm gonna listen to you. This is just normal breathing. I might say take a couple of deep breaths, okay?
Okay.
Go ahead. Take a deep breath. Good, okay. Another deep breath. Back to regular breathing. Okay. So all lung fields are clear, equal, and bilateral. And that concludes our examination. So here what I would recommend is obviously keep up with using your inhaler if you have to. We're going to get you, I'll go look in your chart and I'll let you know what that medicine is before you leave today. And then also I noticed that your lips are a bit cracked. Do you use anything for that right now?
No, I couldn't find a good chapstick.
Okay, well sometimes chapsticks can actually have a little bit too much alcohol content in them, which can dry them out. I experienced some of it myself. So what I recommend is vitamin E oil actually. So if you order it, it's like $9 on Amazon. Go order it and you just kind of rub it on your lips, slather it on there.
Perfect.
Alrighty dear, it was nice to meet you.
Nice to meet you.
Okay.